So today we are seeing Jake, who just sustained a left patella fracture. He was just in a cast for 6 weeks and just got out of it. And when he came into the clinic, we realized that he was struggling with range of motion when it comes to flexion. He was only getting 20 degrees of flexion. So today we're going to be using heat as our modality. Since he is 6 weeks through with his injury, this means he's at the end of proliferative stage and entering into the maturation stage. So when we use heat, things that we want to look for, indications of this, it helps with range of motion. So since he's struggling with flexion, that's one reason why we can use heat. Another reason is to help with pain and for overall facilitating healing. Some contraindications that we should worry about and ask our patient before we start this treatment is if there's any active edema, if there's any acute injuries anywhere else, if he has skin anesthesia, as well as impaired circulation or peripheral vascular disease. So when we get started with heat, I plan on doing it for about 15 minutes. We're going to ask our patient about if they have any preferences or if they have any problems with contraindications with heat, and we'll go from there. Hi, Audrey. Or your name's not Audrey, you're Jake.
That's okay. I go by either.
Okay. Hi, Jake. How are you doing today?
Good. How are you?
Good. So I heard that you're having problems with your left knee, that you had some fracture to your left patella. Is that correct?
Yeah, I'm having a hard time moving it.
Yeah. So before we get started with any exercises today, I think it'd be a good idea if we warm up your tissues and muscles, just so we can see if that helps with your range of motion. Is that all right with you?
Yeah.
Perfect. And then do you have any problems with heat? Do you have any skin anesthesia or peripheral vascular disease, blood circulation problems?
I have really good circulation.
Awesome, good. So the first thing I'm going to do, I'm actually going to get this pillow to put underneath your knee. Very good. Relax that. And I'm going to get your heat for you. So on this heat, I have around 6 to 8 layers just to make sure that it doesn't get too hot on your knee. And if it does, I'm going to set a timer for you, and you can ring that. Or I'm going to set a timer and also give you a bell to ring in case it gets too hot. Then you can just ring that and I'll come over and check your skin. Your skin looks pretty good right now already. I'm going to lift your knee up, wrap this underneath. Very good. I set this timer for 15 minutes. I'm going to put this under here. Then if you need me, you can tap this, okay?
Okay. Can I take it off if it gets too hot?
Yes, but ring the bell so I can come over and take it off for you if that's okay. So 15 minutes go by. I come back and assess her. I want to make sure her skin isn't too red when I take this off. Is it too hot or has anything been going on?
No, it feels good.
Good. I'm just going to take this off and assess your knee. Make sure everything looks okay. Looks perfect. Alrighty.
Perfect. Should we go start our exercises?
We should.
Thank you.